Welcome back to our channel. So today we are going to do a case study about this one dog. So what happened to this dog? Okay, so this dog is a very happy dog, goes to the park all the time. So what happened is that this dog suddenly come down with urinary tract infection, UTI. So this is basically due to 3 bacteria, Staphylococcus, Pseudomonas and E. coli. So as usual, when you get bacteria infection, we are giving the dog antibiotic course. So yes, I will do that. And then suddenly 2 weeks later, the dog fell sick, become shy, depressed, dull, and suddenly now the dog kencing pun susah, and then very little amounts of urine and all. So what happened to the dog? So let's find out.
Okay, today I will explain about how this UTI happen. Okay, I will explain how the mechanism that UTI can infect the urinary bladder. Okay, this is happen when the bacteria that colonize the portion of urinary that actually that is normally sterile, and then the essence of bacteria is actually the most common that can cause the UTI in the urinary bladder. And then the fecal flora, actually the fecal flora from the fecal itself contaminate the perineum, and then they acid into the urethra and then goes to the urinary bladder. And then the bacteria, the organism itself that actually successfully gain entry into the bladder, then acid into the ureter and then cross into the renal pelvic epithelium, and then lastly it will enter the renal parenchyma of the tissue that will cause the UTI, and lastly it will cause UTI tract infection. That's all.
Hi! So, what is the source of this ascending bacterial flora? It could come from vaginal, distal urethra, and also preputials. And usually for healthy animals, they are exquisitely resistant to the bacterial flora. But if our body natural defense mechanism starts to fail ourselves, it will cause the UIT problem for the animal.
Hi! So we're going to continue our video about this UTI. So development of UTI means the host defense are pretty much overwhelmed by all the pathogens. So in order for UTI to develop, the animal must be exposed to this neuropathogenic bacteria in sufficient numbers required. And other than that, animals must have epithelial cells for the neuropathogens to attach. And then when this unit infects, it's below pars, very suboptimal. So that's why UTI can happen to the dog. We guess.
Hi guys, Makcik Rosman speaking. So high risk for development of UTI occurs in dogs with anatomical abnormalities of the genitourinary system, such as the ureter remnant, ectopic ureter, excessive variable skin pool, or possibly vestibular vaginal stenosis. And then exogenous steroid used in dog, endogenous hypoadrenocortism, and also diabetes mellitus, all at a risk for development of UTI in dogs. So that's all from us. Thank you.
The diagnosis of urinary tract infection are history taking and physical examination. So, for history taking, the client should be questioned whether the dog generates a normal urine stream or if a normal volume of urine is produced in a single attempt at voiding. Has the owner noted any signs of urinary incontinence? If blood is present in the urine, is it present throughout the urine stream or only at the end of urination? For physical examinations should include a rectal exam to palpate the urethra and prostate if applicable. Bladder size and tone should be evaluated. It is best to palpate the abdomen both before and after voiding. External genitalia should be closely observed. So, does anyone know any other diagnosis?
Yes, I do have an idea. One of it is urine culture. Urine culture is one of the techniques to detect specific bacteria that causing the disease. The first step is we can do the urine sample by cystosynthesis and catheter into the bladder. Next, we can do a smear on the nutrient agar and incubate at the body temperature. But the positive results after 24 to 48 hours is the presence of small colony of yeast and bacteria. Then we can identify the size, shape and the color. Next, we can do the gram staining under the microscope to see what type of microorganism that is present. Next, we can do sensitivity test to determine the most effective antibiotic to use against the bacteria. The urine culture test and sensitivity test is the best method to select the antibody to resolve the infection. That's all from me. Thank you.
Let's move on to our next diagnostic tool, which is the urine analysis. So basically, this process helps us in identify if the animals are having an infection, but it cannot exactly identify which type of bacteria that causes the infection. So basically, what are the knowledge that we can get from this process? So first thing first, we can know the pH value of the animals, the protein value, also the glucose, and other than that, we can know the keto levels and bilirubins, and also other than that, the blood levels, the nitrates, and also other substances that can cause function or dysfunction of the kidney and other organs.
There are another two diagnoses that we can do to diagnose urinary tract infection, which is abdominal radiograph and also abdominal ultrasound. And the main focus here is urinary system. The function of abdominal radiograph is to diagnose radiopaque urolith, to evaluate the renal size and also bladder position. And for abdominal ultrasound is to see the thickness at the bladder wall, mucosal irregularity, and also radiopaque and non-radiopaque urolith. So here I have an example, two examples for this is for radiograph and this is ultrasound for the abdominal endodox. That's all. Thank you.
The treatment action for Slater the dog is using gentamicin and enrofloxacin antibiotics. Why? Because gentamicin and enrofloxacin are effective against Staphylococcus, E. coli, and Pseudomonas. The mechanism of action of enrofloxacin. First, the enrofloxacin will diffuse through the plasma membrane of gram-negative bacteria to porine channels. In the gram-negative bacteria, there is a DNA gyrase that will uncoil DNA to make new DNAs via the polymerase. The enrofloxacin will bind to the DNA gyrase, thus inhibiting the uncoiling and production of new DNA. The bacteria will then undergo bactericidal effect. Next is in gram-positive. The enrofloxacin will diffuse through the plasma membrane of gram-positive bacteria. In the gram-positive bacteria, there is a topoisomerase which is responsible for uncoiling of the DNA and production of new DNA. The enrofloxacin will then bind to the topoisomerase, thus inhibiting DNA production. Thus, this introduces the bactericidal effect. Next is the mechanism of action of gentamicin. In the gram-negative bacteria, gentamicin will then go through the plasma membrane through the porine channels. Inside the bacteria, the ribosome is responsible for creating amino acid chains. Gentamicin acts on the 30S subunit of ribosome by binding irreversibly to the site. Thus, the tRNA could not bind to the ribosome and no amino acid chains will be produced. Thus, this induced the bactericidal effect. For prophylactic treatment, we will introduce probiotics into the small intestine of Slater. Probiotics will then bind to the small intestine, thus inhibiting pathogenic bacteria to bind to the small intestine. The end!